So I'm here to talk to you today about that problem that we all hope isn't actually going to happen to us. And that's the little baby who cries a lot in the first 3 to 4 months of life. The work that I'm going to share with you today comes out of my many years of research looking at the latest in the international evidence in this field, and is also drawing on my own publications, most recently, in fact, in the British Medical Journal. So about 1 in 5 new parents report that their baby cries and fusses a lot in the first few months of life. Grizzling and crying is actually a baby's way of communicating that something's bothering him or her, although it can be very difficult to work out what that actually might be. Crying itself is in fact a very late cue, and parents generally try to get in early, so looking for those grimaces, grizzles, wriggles, the little bobbing of his or her head. But we can't always be successful with our strategies. I should just say, actually, right up front, that if a carer starts to feel overwhelmed or angry, and that so easily happens when we have a little baby who's screaming and screaming and screaming hour after hour, then that carer does need to know that it's perfectly okay to put that little baby down in a safe place and walk away for a time. So once the baby is actually crying in earnest, of course, it can be very difficult to console that little person. You don't need to take on board the details of this slide showing the brain science behind what's happening, but those of you who are particularly interested in the brain science could even go to my personal website where there's a handout for parents that looks at it in more detail. But the reason why babies become inconsolable when they're crying and crying is that they become stuck in a brain hormone loop. So the crying itself triggers more crying, and then it becomes so difficult to soothe that little baby. All we can do then is hold, make soothing sounds and wait. And perhaps if the baby's in the first days and weeks of life, then you might want to try skin on skin, which is lying back with your own chest bare and the little bub with his or her chest bare, or maybe in a little singlet and nappy. The latest research shows us that babies in our society, normal healthy babies, do cry on average about 2 hours from birth in a plateau to 6 weeks of age, and then from 6 weeks of age the crying decreases to a bit over an hour a day in total at 12 weeks, and then it tends to fade out from there to pretty much being gone by 16 weeks for most babies, and usually without any long-term consequences at all. We can't always know why any particular baby cries, of course, and genetics and temperament seem to play a part. But I am here to tell you today that there are also some things that we can do to help babies who are crying excessively. And it's important as parents to know about these things. Of course, parents receive a great deal of conflicting advice when they have a baby who's crying and fretting. And this in itself can be incredibly distressing to parents. And we have to ask ourselves as health professionals, why is it that we've reached this situation where parents are being totally confused by the advice that they're receiving? And to make sense of it, we actually have to pause for a moment and consider our history. By the early 1900s, my own profession had actually taken over the care for mothers and babies. And a lot of the traditional social behaviours that supported mothers and babies through this very challenging time had fallen by the way. Now, my own profession are absolutely terrific at saving lives, preventing injury and treating disease. but we've never really known how to support the normal brain hormones of mother and infants in these early days and weeks. These brain hormones were put in place through millions of years of evolutionary history to make things as easy and as smooth as possible to ensure the survival of the human race. But unfortunately, as doctors, we have not really known how to support them, and in fact, unintentionally, as we focus on those absolutely vital tasks of caring for the fundamental health needs of mums and babies, we unintentionally may be placing obstacles in the way. So an example of this is the use of some medications, many of which are necessary, some of which perhaps not so necessary, that we use in labour, that then can interfere with the baby's capacity to feed in the first hours, days, even weeks after birth. So into this confusion actually in the mid-1900s with plummeting breastfeeding rates, screaming babies and terrible undetected postnatal depression, a doctor called Truby King invented a method called scientific mothering, which taught measurement and regulation as a way of exerting control again in the kind of chaos that had arisen in mother-baby care. This system of measurement and regulation was taught widely to health professionals and fitted nicely with the findings emerging out of America with the new work in behavioural psychology. So the outcome of this quite logical approach to the historical problem has been the belief that life is easiest if parents use a regulatory approach to feeds and sleeps from the first weeks and months after birth. However, if we were to actually integrate all the latest evidence that's pouring out of a whole variety of disciplines interested in infant crying, like neuroscience, human lactation, evolutionary biology, developmental psychiatry, a completely different picture emerges. That life is actually easiest if parents can take advantage of the normal mother-infant brain hormones from the first weeks and months after birth. And at Possums, because we're interested in the evidence and the very latest integrated approach, this is the kind of approach that we offer. So what can we actually do if parents find that they have a little baby who's crying and fretting a lot in the first weeks and months of life? Let me remind you right at the outset that most babies will cry inconsolably at times, and this is normal and it's no one's fault. But it's really important also to let you know that you do need to seek help as early as possible if this is becoming something of a problem, if it's happening a lot, because there are things that we can do to help, and the earlier we get in with that kind of support, the better. So the Possums approach actually organises all of the evidence into 5 different areas that we look at. We work through baby's health, mother's health, feeds, sensation and sleep. Now again, you don't need to take on board the details of the neuroscience, but for those of you who are interested, I do have that handout on my website. So it's vital to exclude any underlying medical conditions that might be causing your baby to cry. And then once we've done that, it's really important for all of us, both as parents and health professionals, to know that one of the big areas in the 1900s that suffered tremendous knowledge loss, just when knowledge was exploding across so many different fields, has been in the field of human lactation. So personally, when you see me, I'm not concerned about whether your baby's being breastfed or formula fed. My concern is to support both your and your baby's health and well-being, and to help you have as much pleasure and relaxation with your baby as possible. But I do need to let you know that even to this day, we know from the research that doctors, nurses, and the researchers themselves, even those who are very positive about breastfeeding, are simply not trained to identify, let alone manage, many breastfeeding problems. This is very important to know because this has given rise to all sorts of misunderstandings in how we go about dealing with unsettled babies. If your baby, who is less than 3 to 4 months old and who cries a lot, is refusing the breast or the bottle, pulling away, often arching his or her back, which is a sign of protest, really, in babies, even if your baby's gaining weight nicely, your baby has a feeding problem and needs to see a feeding expert, such as a lactation consultant or a speech pathologist, if your usual health professionals are unable to help you. So then that brings us to the whole confusing topic of reflux. Is it reflux? So again, let me say at the outset, everyone has reflux. In babies, it's more likely to come up out of the mouth as a little vomit or a posset or a spill because of the short esophagus and because of the effects of raised tummy pressure, for instance, after a bout of crying. Reflux is pH neutral for 2 hours after a feed, whether it's a breast feed or a formula feed in babies. So you can see that it can't harm the esophagus. It's not acidic, it's neutral. Researchers have put endoscopies down the esophaguses of many babies who have crying problems, vomiting, and feeding refusal, and the esophaguses do not have inflammation. So it's actually very widely accepted across all the prominent international pediatric gastroenterologists that gastroesophageal reflux disease isn't a cause of crying in babies who are otherwise well in the first 3 to 4 months of life. That then brings us to allergies. Is it allergy? Now, cow's milk allergy in little babies up to 3 to 4 months of age usually presents with skin rashes or with some constipation or even with a little bit of blood in the stool. It doesn't usually present with crying, in fact. However, and particularly if you or your partner have a known cow's milk allergy, it actually might be useful to try, if you're breastfeeding, a maternal elimination diet of dairy. And you could give yourself 2 weeks, and if it's not made a difference to the baby's behaviour, then you know that it's not likely to be cow's milk allergy that's causing it. We do know that formula-fed babies who are crying a lot in the first few months of life do better, it seems, on an extensively hydrolyzed formula after you've gone through all the other things that we may be talking about. It can be worth trying that extensively hydrolyzed formula. Breastfeeding babies don't vomit with an allergy, except in very rare and very severe cases. So that's also important to understand. There's also growing concern that maternal elimination diets in those first 3 to 4 months of life, certainly up to 6 months if you're breastfeeding, actually relate to the dramatic increase in paediatric allergies a little bit later in babyhood or childhood. It's now thought that the food proteins in tiny doses that come through the breast milk actually prime the baby's immune system and help the baby develop a tolerance against allergies. So apart perhaps from the cow's milk elimination diet, in breastfeeding mums, those maternal elimination diets in an attempt to help with crying in your baby are just not appropriate, not necessary. Unless you have a known allergy yourself, in which case you do need to avoid that food. It's worth knowing that the gut contractions and gut bacteria in babies are affected by stress, and they are affected by a condition called functional lactose overload, which in fact is a correctable, easily correctable breastfeeding problem, often undetected, but is the only kind of lactose problem that's relevant to crying babies. So then, of course, we need to think of mum's health, and it's really important that we don't miss any postnatal depression that might be happening. But having said that, most mothers with a baby who's crying excessively in the first few months of life are stressed and exhausted. That's normal. Now, there are all sorts of unidentified feeding problems that can cause babies to cry excessively. And if this happens in the early days, it certainly starts to set up neurological pathways so that even when the initial trigger has passed, we may still then have a stressed and crying baby. So it's very important to get in early. A baby may be gaining weight adequately, but still have a feeding difficulty. Now, this little bubby has a tongue tie. That's an example, one of many kinds of feeding difficulties that are often undetected but can cause excessive crying to continue then down the first few months of life. Now, we do need to know that prolonged or excessive feeding is a sign of a feeding difficulty or a feeding problem and requires help from somebody with expertise, not feed spacing, which may actually make the problem worse. It's really helpful to understand that babies have a very powerful biological drive for a rich sensory diet, and this is often poorly understood in our society. In fact, there's quite a lot of emphasis out there on not overstimulating your baby, and this arises out of work that was done on premies, because it's true that there's certain kinds of stimulation that are not good for any human being. So, for instance, blaring radio or television or the fluorescent lights 24 hours a day, we certainly know that that's not good for any human being. It certainly makes babies more unsettled. But in fact, babies have this very powerful biological drive for a very rich sensory diet. And frequently a baby may be cueing that they're wanting more input, and that may be misread as a tired cue. So just think for a minute about how stepping outside with an unsettled baby often causes that baby to immediately settle. That demonstrates how the baby's hungering for rich, diverse sensory input. Slings can be one helpful method, although you do need to have them so that they're ergonomically sound on your hips and the baby vertical, and the baby's hips also nicely abducted in a good position. It's reassuring to know that crying babies don't wake more at night than other babies. They might, however, be awake for a little bit longer as they cry, and we need to find ways to make those normal brain hormones of sleep work really well for us. A satisfying feed in the baby's tummy strongly triggers the hormones of sleep. So if your baby's unsettled, I wouldn't burp. The baby will release air naturally anyway, and actually sitting the baby up and burping can disrupt that nice flow of the brain hormones into sleep. Similarly, during the day, a feed-play-sleep cycle, if you've got an unsettled baby, will disrupt the normal hormonal flow into sleep. Regulatory approaches for crying babies in the first 3 to 4 months of life don't make any difference to the baby's crying, and they may make crying worse. The needs of babies for sleep are very highly variable. That's the one thing that's very definite and agreed upon in all the sleep research. So sleep algorithms are not helpful. They just make us anxious because our baby's not fitting into them. The needs can also vary very much from day to day. So in fact, we can trust our babes to self-regulate sleep without needing to fret about how much sleep that baby's getting. Mothers with unsettled babies are actually best focusing on getting out of the house and meeting their own needs for social and physical activity, which will inadvertently meet the baby's need for a rich sensory diet if you've got the baby in tow. And you can see that if we've got a baby who's satiated with all those nice hormones helping the baby move into sleep, we've got rich sensory stimulation, then babies are biologically primed to take the sleep that they need. So that's a very simple overview of what is actually a very complex problem. And I just leave this thought for you to take away, that In fact, it will pass. You can take heart. Before you know it, they'll be off at university like mine. So just goes like that. Thank you very much for your time.